Could the history of like other lymphatic cancers be connected also to breast cancer? Today on Nana Konamah TV, we talk breast cancer, the science, the prevention, and the treatment with Dr. Grace Buckman.
The person might think that she has lumps because every breast, that feeling? Yeah.
The first time I did, I was like, this is lumpy. Dr. Grace Buckman is a medical doctor and currently the medical director at Sonotech Medical and Diagnostic Center. She attended University of Ghana Medical School and holds an EMBA from University of Ghana Business School.
Usually when you talk about staging of breast cancer, there's a stage 0, 1, 2, 3, 4. So stage 3, 4, those are the advanced stages of the disease where you have it spread all over the body.
Over the past year, Sonotech has joined the National Breast Cancer Unit to celebrate the Breast Cancer Awareness Month in October. This year, the theme for the celebration is Detect It, Treat It, Defeat It. This is to help create awareness of breast cancer and the importance of screening modalities. Help me welcome Dr. Grace Buckman. Hey there guys, Nana Konamah here, and as always, I am here to help you find what? Your authentic self. I'm wearing pink today. Yes, why? Because it's October, and October equals Breast Cancer Awareness Month. So I have none other than Dr. Grace Buckman on my couch today to speak a little bit about breast cancer. What are the signs? What are the treatment options? And how should we be taking care of ourselves? I can't wait to get into this conversation. It's going to be super informational. We hear a lot as women how to be taking care of ourselves. There's so many issues out there. There's fibroids, there's breast cancer, but October is pink for breast cancer. So help me welcome the awesome, the illustrious Dr. Grace Buckman. So glad you're here, Dr. Grace.
Yeah, thank you so much for having me. Yeah.
Of course. So I'm in my pink because, October being Breast Cancer Awareness Month, my work usually centers around fibroids, which doesn't mean that breast cancer is not an issue.
Exactly.
Yeah, so I wanted to bring you here because I know that not only are you a doctor, but you're also an advocate specifically when it comes to breast cancer awareness. And so this conversation is really dedicated to you. So at your clinic, Sonotech, you do all manner of diagnostics, including, yes, my girlies out there who want to get ultrasounds to check on those fibroids. Dr. Grace is the one for that. But including breast cancer screening. So, number one, can we go over some of the signs, and also at what age would you suggest that women should begin getting breast cancer screening?
Okay. So thank you again for having me here. I'm really excited about it. You've already mentioned that October is Breast Cancer Awareness Month, and globally, the attention is on women and also on breast cancer. And the reason why this is the case is there are increasing number of women out there who get diagnosed at the later stages of the disease. So later stages, usually when you talk about staging of breast cancer, there's a stage 0, 1, 2, 3, 4. So stage 3, 4, those are the advanced stages of the disease where you have it spread all over the body. And unfortunately, that is the time where we realize most women present to the hospital. So during this month of October, what we do is to create awareness on breast cancer, importance of screening, the screening modalities, and the importance of women getting screened early as well, because once breast cancer is picked up early, the 5-year survival rate is almost 100%. But once you present at the later stages of the disease, then your survival rate actually reduces. So we can talk about the signs and symptoms. Like any form of cancer, usually it starts very, very silent. I know the way women like to go to the hospital when they have like pain or something that really, but this is something that starts very silently. If you don't check it out, you will not know there's something going on. And of course, it's breast cancer, so it will start in the breast. And like any cancerous process, there is abnormal division of the cells in the breast, and then eventually it forms a tumor. So there's that small mass or tumor sitting in the breast when it starts, and then with time it gets big. So one of the signs or symptoms that one of the symptoms a person can have is feeling of a mass in the breast. But by the time you feel a mass in the breast, it means it's become big. One of the other thing will be changes in the skin of the breast. One of the reasons why we encourage people to do the breast self-examination is for them to know how their breast looks like. How my breast looks like will be different from how yours is. The more you examine yourself, you know what your normal is. So one of the symptoms is a change in the skin of your breast. It can probably become reddish. It can also become dimpled, like the normal dimple we have here. You can see something like that. You can see something like that on the breast. And then there's always there's also a characteristic sign on the skin called the peau d'orange. Peau d'orange meaning it resembles like an orange. You know, the way you have all those spots on the orange peel. So in advanced stages, you can get the skin of the breast to become like that as well. And of course, the breast affected can also generally become bigger than the other breast that's not affected. The other thing you can see is with your nipple. Once you're also doing the examinations frequently, you know how your nipple looks like. Most people will have their nipples everted, standing out nicely. There are some people who also have their nipples being flat. If that's how yours is, it's okay. But one of the signs you can pick up during the early stages of breast cancer is for the nipple to be retracted. So instead of standing out, it's retracted inside. Then you also move to nipple discharge. Ideally, if everything is normal, I don't expect you to have any discharge from your nipple, except, of course, you're breastfeeding, you know, there's milk coming out and all that. But during the advanced stages of breast cancer, you can also have a nipple discharge, not just like a watery or, you know, serous, but it can also be bloody. Once you see that, it's a sign that you really need to rush to the hospital. These are some of the local signs you can pick up from the breast itself.
Right.
But remember, as we said, it's cancerous, so it can travel to all parts of the body.
Right.
Once it gets to your gastrointestinal tract, it can get to the liver. In that case, you can even present with jaundice. You can present with abdominal pain. It can get to your chest. You can present with chest pain. You can have cough, not just cough, but coughing and bringing out blood as well. It can even go to the brain, where you have headaches and then you have seizures as well. So for this, like the spectrum of some of the symptoms you can pick up. If it's very early, most of the time, no symptom at all. But once it progresses, you start finding the changes with the breast, and once it advances, you have all these other symptoms appearing. So having said that, what we advise is for women to start screening at age 20. Age 20 is a very critical time. We know that, well, definitely all things being equal, by 20 you'd have started your period. I mean, you'd have had your menarche. During that time, the breast undergoes a lot of changes because it has receptors that are sensitive to estrogen and progesterone. These are hormones that women have. So during that period, there's a lot of division ongoing in your breast. Every month after your period, when you are 20 years and above, we encourage you to do the breast self-exam. So you do it yourself. And it's advisable to do it after your period because during your period, the breast also undergoes a lot of changes. So probably 5 to 7 days after your period is the best time. And you do it every month. Once you're doing it often, if there is any change, you pick it up early. For the 40 plus women or postmenopausal women who are not having regular periods, we advise that you just pick any day in the month. So if I'm probably postmenopausal and I have decided to do it the first day of the month, it means I need to be consistent with it. The first day of every month, I need to do the breast self-exam. And the process is very simple. You can either lie down or you can stand and then do it.
Right. So, so take me through the process.
For breast self-exam, what we advise, as I said earlier on, is for you to start after 20 years. And after 20, the best time is 5 to 7 days after your menstrual period. If you're postmenopausal, just pick one day in the month that you do it. Basically, you just start with inspecting the breast.
So how would I do it? So I'm getting a little peek here. Do I start from above? Do I start from the side? Do I start from below? Because sometimes, the mammary gland is also is naturally lumpy on its own. The mammary gland is that thing inside your boob that produces milk, and all mammals have it. So where am I going? Does it include here?
Okay, so when you look at the anatomy, can we use it? When you look at the anatomy of the breast, you rightly said it.
Okay.
It expands all the way from under the breast, even up to the clavicle level. There's some breast tissue over there, even to your armpit as well.
So all the way back here.
Not really. It doesn't go back like that, but to the axilla region, the armpit region.
Here.
Yeah, exactly.
Where my Rapunzel is. Okay, so here.
From that to the midsection.
So all of this is breast.
Exactly. So it's not really just like the protrusion that you see.
Yeah.
Yes. So when you start, you need to just show everything well. Of course, not wearing your bra. And
I can do it.
and stand in front of a mirror, because that's how you see the reflection well. And if you have a breast that sort of sags a little, you need to raise it up, because some of the lesions can be hiding right under. Yes, so you need to raise it up and look. So your first step is just inspection. You look well. Is there any change? Is there any, abnormality you're seeing? After inspecting, then you need to, before you lie down, you need to just milk out your nipple, try expressing it to see if something will come out.
Okay.
Yeah. So you do it in two planes, this way and that way. Once you finish that, you just lie down. You can do the palpation lying down. If you want to examine your left breast, you put your left hand behind your head. Once you are in this position, the breast sits. It sits on the chest wall. Yeah, exactly.
Well for examination.
Exactly.
Got it.
Then, with the flat of your hand, you just palpate all the areas you've described.
Right.
So there is something about palpating your breast. You never hold it this way, you just use the flat of your hand. Anytime you hold it this way, you always feel a lump, but you just use the flat of your hand to do the palpation. It's necessary you palpate the axilla, the armpits as well.
Yeah.
Because some of the lesions actually hide, then that's where it can even start from.
Wow.
So once you finish with the left, you do the same thing with the right. You just examine all the areas very well. And then basically, once you are done with that, that should be okay for your breast.
Okay. So what are we looking for? So I'm examining, but what am I looking for when I'm examining?
Okay, so when you're examining, from your inspection, the things we mentioned earlier on, is there any changes to the skin? Is there any dimpling in my skin?
Right.
Is there any rash or anything on the skin that I think is different or is new? Once you're expressing the nipple, is there any discharge that's coming out? Now at the palpation stage, what you're looking for, is there any lump I'm feeling? The more you do it, the more you know how the normal feels. If someone starts doing it now, the person might think that she has lumps, because every breast, that feeling. Yeah.
The first time I did, I was like, this is lumpy. What are they talking? So I was freaked out until I kind of understood sort of what to look for. Is there a particular shape or texture if you suspect a lump? Is there a particular shape or texture or feeling we're looking for to identify that this may be something I want to check out?
So, as I said earlier on, every breast feels different. There are some people with dense breast, and sometimes for that it can be very confusing, because dense means you have more of the glands compared to the fatty tissue in the breast. So you need to do it with time. Even sometimes the very small ones, the clinician can even miss it. That's when you move to the next stage of your screening. That's the imaging modalities. Because, although we're encouraging us, all women out there to be doing the breast self-exam, that alone doesn't solve all the problems for us. So you move to the next stage of screening. That's the clinical breast exam. So in that case, you are making a clinician do it for you. And for that one too, the rule is that for those more than 20 years, you should do it at least once in 2 years or 3 years. And then those 40 years plus, they can do it once a year. So you see how it flows. You do it yourself every month, and then once in 2 to 3 years, you let a clinician do it for you. Before you know, you're missing something.
So I've been bad. I'm going to be very honest. I haven't had a clinician screen me in a long time.
So this year, you need to take advantage of
I
this.
think, you know what? This year, I'm, you can't, you gotta walk the walk also. So it's not just about talking. So I'll see you. I'll see you down at Sonotech.
So it's really necessary for you to get your clinician to do the examination for you. Although the clinician is more skilled, there are even some lesions that a clinician can also miss out. So then the next step will be your imaging modalities.
Like a diagnostic test of some sort, right?
And then for the imaging, usually there are a number of them that are recommended. For those above 40, again, because of the nature of the breast, they do the mammograms. So like you're doing your mammograms once in a year, once in 2 years, for 40 plus. Some people actually complain that mammograms are painful because of the way it's done. But the issue is you need to look at the what is helping you to do rather than just looking at the short pain you go through, because it's such that it's more like an X-ray of the breast. So the breast is put in between two parts like this, and then so like the pressure. We get a lot of people come and complain. You are telling us to do it's so painful. Someone told me, is there another way for me to get screened? Because
and I imagine if you have smaller breasts, that will probably be a little awkward.
It's no matter the size or it's done.
Okay.
It's just that the pressure but the benefits outweigh, the kind of pain you are going through during that short period of time. So definitely 40 plus, you need to be getting your mammograms done.
40 and up. So risk factors. Can we go over risk factors? So I know someone whose grandmother died of breast cancer, mother is a breast cancer survivor. How concerned should she be about her breast cancer journey?
Oh, she needs to be very, very concerned. Very, very concerned, because for breast cancer, one of the main risk factors will be genetic mutations in certain families or a family history. So there are some families who have certain gene mutations. One of the commonest genes is what we call BRCA1 and BRCA2. And that reflects in probably your mom, your grandma, your aunt, a number of people in the family getting breast cancer. Sometimes not just breast cancer, there are other types of cancers that increase your risk of getting breast cancer if you have it in your family, like ovarian cancer.
Right.
Yeah, so if you have a family history of ovarian cancer, anyone in the family, mostly the close family members, it also puts you at risk. For you, then the screening even becomes more important. And I know outside some people are even advocating for prophylactic mastectomy for those kind of people.
I think Angelina Jolie did one of those because her mother died of breast cancer. She had an aunt who passed, and so she did a prophylactic mastectomy.
Because, of course, once there's no breast, there's no way you get there. Exactly, yeah. So once your risk is that high, your risk increases more than about 3 to 5 times like the risk of the general population once you have the family history.
So you have the family history, but you don't have the genetic mutation. Should you still be concerned?
Oh, yes.
Okay.
You still both the genetic mutation and then the normal family history. Those two groups are still at a very, very high risk.
So then my question is, does breast cancer only affect women?
Okay. Once is the breast. Men also have breasts, remember? Every
Do they have a
man.
mammary? Do men have a mammary gland?
They do, but it's not really developed well.
Got it.
Yeah.
Got
So
it.
they have, it's basically the same structure like ours, but of course our glands and everything is really well developed, but theirs is not developed as well. Men get about, when you take the whole population of people with breast cancer, 1% of it will be men.
I mean, 1% isn't small.
Yeah, it's quite significant. I've seen a number of men with it. And for the men, so you see, although we usually don't pay attention to them. Once a man gets breast cancer, it's very aggressive. Yeah, once a man gets breast cancer, it's very aggressive. And for men as well, we realize that most of the times, for a man to have breast cancer, you realize there's a family history or genetic component to it.
Got it.
Exactly.
Got it. I was going to ask you another question was that, because you talked about the history of maybe like ovarian cancer or breast cancer. And this is kind of related to men getting, breast cancer. Could the history of like other lymphatic cancers be connected also to breast cancer?
It's possible. Once there is a history of, but one of the notable forms of cancer associated with breast cancer is ovarian cancer.
Ovarian, because hormonal.
Once there is a history of that in the family, or even there's a history of breast cancer in the family, then it increases the risk.
Wow.
So there are some other risk factors. Usually we would say for the risk factors, either it's modifiable or it's non-modifiable. So modifiable means you can actually do something about it. Non-modifiable, you cannot do anything.
That's the one we like. We like the modifiable because that gives us hope.
Okay. So, let's look at both ways.
Right.
So when you're talking about...
But we're biased towards the modifiable.
So the modifier, there are actually a few of those.
Got it.
And for those ones as well, it's not really specific to breast cancer. It's usually most types of cancers.
Right.
For instance, your weight. Okay. So these are general stuff. So most of the times, if you're obese, especially during your developmental stages, throughout, your risk increases, not just for breast cancer, but most types of cancer as well. Smoking increases your risk for most types of cancers.
Smoking cigarettes?
Smoking cigarettes, smoking. So sometimes people want to push you to distinguish what type of smoking you're talking about.
Yes. Vapes.
But smoking is smoking. Once you're exposed to it over a long period of time, there is some form of risk associated to it.
To all forms of smoking.
Yeah, there's some form of risk associated to it. And then the other type of modifiable will be also checking your diet generally. If you are doing more of the fats, more of the processed foods, and generally it sort of increases your risk as well.
Can I just interject? Yeah. Because I think we say that processed foods, increases risk, but actually the WHO released a study a couple of years ago that says that processed meats, they don't use the word causes often, especially when it comes to cancer, because causation is such a strong word, and but they moved away from correlation to say causation, that it's not just linked, it's directly causes it.
If you look at most of the disease processes happening now, diet definitely has a strong, whatever you take in.
And what you're leaving out. So it's not only what you're eating, it's what you are not eating that it's killing us,
So that's why people are encouraged to do more of the naturals, more fruits, more vegetables. So the modifiable ones are just a few, and they usually related to a number of processes, not really specific to breast cancer.
Got it. So we're here in Ghana. A lot of us deal with fibroids, and so there's a lot of conversation around fibroids. What are we looking at in terms of risk as Ghanaian women for breast cancer?
Okay. For Ghanaian women, I think the risk would basically be the same.
As far as global, it matches globally,
it matches the global picture. When you look at the genetic familial component, it's not so much as strong as some of the other components. But surprisingly, there is also a significant number of people that you go through the history, everything, you don't really find any risk factor. And for that's the kind of picture like that's one of the picture that's being created here in Ghana, because we would always go through the risk factors, whether modifiable, non-modifiable, but you realize that really there's nothing. Do you have a family history? No. Do you have this? No. Do you have that? No. But then the person presents to you. For instance, last year we during the screening period, the number of patients that we saw, most of the times I would say that you don't even find any risk factor. Most of the time, the genetic component probably about 10 to 15%.
Ooh, and
Yeah.
it's not. It doesn't seem like
Yeah.
it's like well studied here.
Yeah, yeah.
Wow.
But there's still a lot of research ongoing. There's the National Breast Cancer Unit at Kolebu, and over the years, they've done like a lot of work. There's been a lot of research. There's been a lot of education. During the October campaign, they are one of the main groups that actually spearheads exactly. So although the number of people present at the later stages, when you look at the statistics, it looks like it's getting slightly better.
Yeah.
We're not there though, but it's getting
I
slightly
was going to
there.
say one of the issues here, and we met at a Friends of UNFPA meeting, and which is a collection of professionals and influencers and different individuals in society to come together to advance the cause that the UNFPA presented. And some of the issues that was like swimming around in the room is that we kind of wait for things to be really, really bad before we adjust. Yeah, whether it's like social, like population level socially, part of it is resources, right? The sometimes the issue is that when you don't have a lot, you sort of deal with what you have until you completely can't any longer. But that seems to be sort of the theme, is that we are waiting till
Exactly.
we literally can't go on anymore before we get checked out.
Yeah. So let me just bring this scenario. There was this 25-year-old girl that last year we virtually had to help her with the scans and everything, because this was like really advanced cancer. It's oh yes, and it's gone through the skin. I mean, the smell when it has to be dressed is very, very bad. Wow. And this was someone who was going to be comfortable staying at home because she didn't have any in terms of resources. Yeah. And she was comfortable. At the point she was like, she was just tired. She just waits. Whatever happens should happen. Because although some of the things are covered on the insurance, it's not all of them. Yeah. You still need to, the treatment modalities, you still need to pay. It's a whole lot of process. It's not, and there's like a long-term thing. It's not like one-time payment and you are done. Yeah. Your chemotherapies is a long process. There was this other patient too who did the surgery, did the chemo and all that, and was supposed to come back for follow-up. Follow-ups in breast cancer treatment is very, very necessary, because there's a significant percentage of people, once you've had breast cancer before, your risk increases in having it again. So the follow-up period is very, very critical. So this patient actually went through everything, but then she was lost to follow-up. And then after 3 years thereabout, presents again with just headaches. Just headaches. Just we did a CT scan and you realize that the thing has recurred and it's even spread all over. So this was like a stage 4. Wow. This was someone who had at the beginning a stage 1, which was sorted, and had to, had to come for follow-ups. There's a whole plan for follow-ups. And usually when they come, everything needs to be checked well to make sure it's not recurring. Mm-hmm. And unfortunately, because of monetary stuff, stayed home. It came again, even more aggressive, and stage further, but nothing could be done.
Nothing could be done. And we hear a lot about stage 1, stage 2, stage 3, stage 4. What's happened? Can you walk me through what are the differences? Like, what's happened in stage 1 that makes it significantly easier to deal with than even stage 2, right? So what's stage 1 and the next?
First of all, there's actually stage 0. Stage 0 is when like it's actually starting. You don't even see anything in there, but the process is ongoing. So
That's hard,
even it's really difficult to even detect.
Right.
Exactly, it's really difficult to detect. Then you have a stage one, where you have that small silent tumor inside. There's usually a size definition that's given, but usually stage one is, let's say, about less than 2 cm, small in the, not painful, nothing. Then you go to your stage two, where it's becoming big. So the lump is really getting big inside the breast. At stage three, you are looking at lymphatic spread. So it's going through the limbs,
Right.
sometimes your armpits, your axillary region. You can palpate some of the masses there. Then at stage four, there is metastasis all over, lungs, everywhere. So then, of course, you can appreciate that once it's gone out of the breast, it's really difficult to treat.
Right.
Once it's that small thing inside the breast at stage one, then it's virtually it's easy to treat.
Oh boy. So much.
So screening is like
It's critical.
It's critical, exactly. It's necessary. Screening is necessary. Once you screen, it's picked up stage one, stage two. There is hope. You get to stage four.
The hope
I mean-
dwindles to almost to zero.
Exactly.
So what can we do to help people? You mentioned your specific experience with a particular patient who went from stage one and then to stage four due to follow up, and it's probably monetary. I know you do a lot of outreach and you do a lot of give back. So how are you doing that, especially for my viewers who want to know, hey, we might be able to help people, get in early, especially it has to do with money. How can we help support you get more people into your clinic so that they are getting that screen? And is there something we can do?
So what we can all do is talk about it. Talk about it. Keep talking about it. During the period of October, for instance, we have this online campaign where we're tagging as hashtag Pink It Out. So just do something pink. Just create the awareness on breast cancer. I mean, now we're having this. It will get people. People will start talking about it. People will start, asking questions about it. And really, that's where it starts. Probably there's someone hiding in the house who has something with the breast, and in the rural areas, and a number of things happen. You get people stuck in the, probably it's advanced, the smell and all that, and people don't want to present to the hospital. So it's really about we talking about it, getting the education, right education out there, getting people to understand that there is hope when it's detected early. During the period of Breast Cancer Awareness Month, October, what we do at our facility, and I know many people also do, is to have the free clinical breast exam. So for instance,
You guys heard
Sonotech,
that? Free clinical breast exam. I'm
Yes.
sorry, continue. So
Yes, I'm sorry.
Sonotech, free clinical breast exam.
So at both our branches, we have one in Osu, Dankwa
Right.
Circle, and then Tema, opposite the Tema General Hospital. So you can walk in any day, and then the nurses and the doctors will do the clinical breast exam for you. Once you do it and you need to do a breast ultrasound, we give a 50% discount on the ultrasound, breast ultrasound scan. And then if you need to do a mammogram, we give a 20% discount on the mammogram. And it's going on throughout October. So this is a time that we want as many people as possible. If you're less than 40, you've never even examined your breast, just come in, let's examine it, let's do an ultrasound, let's be sure everything is fine. I think really that's the first step, and that's what we can all do to contribute and reduce the numbers. Just making sure that we identify it early, and then once it's identified early, all the other treatment modalities can be put in place to help the patient.
That's amazing. So as I'm going to walk the walk now, not just talk the talk. I will be scheduling after this conversation, I'll go ahead and schedule my breast examination. She's like, you better, don't fake.
I'll be expecting you.
Yes, we will be scheduling, and I will be right down there at Sonotech to have what would you suggest? I'm 30. So I do the every now and then home breast examination. So am I ready for the big game? Am I ready for mammogram, breast screen? What would you suggest I get into right now?
So first of all, are you doing the breast self?
Yeah,
So
like self-examination.
we're doing it.
Mom, like not monthly.
Okay.
I'll be honest, maybe
Okay.
twice a year.
I mean, that's a start. So we can increase the frequency at home.
It feels like a lot of work, but I'll do it because I'm sure getting breast cancer is more work than getting the breast self-examination.
So once you're doing it at home, during this period, you can come in and then we do the breast exam and also add the ultrasound. Once you do the ultrasound and it's normal, then for you, around 30, that should be good. You don't really need a mammogram. Mammograms are if you're more than 40 years.
Okay.
Yeah.
It's not yet. Great. So, there's a lot of fear around breast cancer, and even this conversation might freak some people out. And I think that part of the reason we don't approach our health is because we're scared that if I get bad news, I wouldn't know what to do with bad news. So, what mindset should we be building around taking care of ourselves this Breast Cancer Awareness Month?
Okay. So sometimes people say, well, if I don't know it's there, then
I'm happy. Ignorance is bliss, 100%. Ignorance is absolute bliss. Like, who wants to know they're dying or potentially dying, right? Like,
but you need to know whether you know or not it's there. So that is it.
You're such a doctor. I mean, only doctors say that. Whether you know or not, it's still there.
It's still there.
Right.
So, I know it's even walking in to ask for it done. It takes some you need to have some courage.
Take a friend, take somebody. I don't know. I feel like
come in a group, come
in a
with
group.
friends, come with someone you trust. It's a bold decision to make that I'm going to get it done. It can be positive, it can be negative. So you need to psych yourself up. And when it comes to breaking the news, it's a whole scale. It's a whole, because we're all different. We all take things
Bad news,
differently, you know.
Assuming it's bad news.
Exactly. So communicating the results to the patient is also a skill that, you know, whoever will do it needs to have to be able to let the patient understand the whole process, that once you have it, it's not like a death sentence or anything. But the whole emotional stress, and it's quite significant. You know, people come in and they are really scared even before going to do the scan or the mammogram. They're really scared. You can actually, it's palpable. You can see that people are really scared.
Oh yeah, I mean, it's terrifying, right? Like, it's, you know, just thinking through it.
But it has to be done. Just let's brace ourselves.
It's a decision, to just get it done, because it is scary to think that, oh wow, like this could possibly be my life, and I could possibly, you know.
So I think the kind of mindset we need to have is know that once you have this, it's not a death sentence, especially if it's seen early. So I think that should actually push you to wanting to do it. Because you know that if I do it and it's very early, then definitely there are options for me. The survival rate is almost 100%. So then I think that should be our mindset, ladies. That should actually push us out there to get screened. Because you have that mindset that this is not a death sentence. Once it's detected early, there can be something, you know, done about it.
Yeah, I mean, I guess that is the moral of the story. Yeah, exactly. The moral of the story is early detection. So, but, you know, there's the moral of the story, and there's how we choose the reality and how we choose to live our lives. So to wrap up, I'm just going to ask you to maybe just go over a couple more things. Sonotech is where exactly in Accra? Okay.
So Sonotech is Sonotech Medical and Diagnostic Center. We currently have 2 branches, one in Osu, Dankwa Circle. It's just adjacent the Sharpnet Internet Cafe in Osu. And then for Tema, it's directly opposite the Tema General Hospital. We can be reached on 020-6161-908. If you have any questions or any doubts on breast cancer, once you call this number, there would be someone always willing to answer your questions. And we'll definitely be expecting masses this October to get screened. We need to save some boobs.
Save the boob.
We need to save the boobs.
Fantastic. Thank you so much, Dr. Grace. Fantastic. So you heard it from here. Early detection really is the best when it comes to breast cancer. This October, pink it up a little bit. Go ahead and get screened. If you're in Accra, check out Sonotech in Osu. If you're not in Accra, you can look at whatever is available to you in your city and what is available to you in your local community. Once again, I'm Nana Konamah, helping you find your authentic self. Now, if you've watched this entire video, you've watched enough to know that you like my content. So go ahead and subscribe. What are you waiting for? Hit the subscribe button and also hit the little bell so you receive notifications whenever I drop new content. Additionally, head on over to nanakonamah.com where all the fun happens, guys. That's where we get really fun and personal. Connect with me over there. Leave a comment and join the conversation. Thank you and see you next time.